Hello, I'm Gary Kennard, your employee benefits broker for Wireless Watchdogs. This is a special presentation for those who were not able to attend the enrollment meetings at the corporate office. For your reference, please have available your personalized worksheets that I email to you. In that email, you also receive links to download the enrollment forms. Please let us know your questions via phone or email, as we must have your completed enrollment forms within the next couple of days. You know that we just completed an open enrollment this past December. And why are we doing it again so soon? Well, the federal government has mandated that all small group employer health plans comply with the new Affordable Care Act, Obamacare, and all of its new provisions. That means that if you're currently on the health plan right now, the plan that you have now will end at the end of March and will no longer be available. Everything is changing. Now, the new health plan is ACA compliant. To explain those new benefit designs, we're pleased to have Benefit Advisor Junior Rodriguez of Choice Administrators to guide you through the information today. I'm going to mute my microphone and hand it over to Junior. Thank you very much.
Okay, my name is Junior Rodriguez. I'm your benefits advisor with Choice Administrators. I'm going to be going over the employee enrollment worksheet for your renewal. Hopefully everyone can hear me. Am I sounding okay there, Gary? Okay. All right, so we're looking at here under the employee enrollment worksheet. First and foremost, you want to ensure that up here at the top right-hand corner, the age, your dependent's age, and your home zip code are accurate. And the reason why is because that's what the rates are going to be based off of: your age, your zip code, as well as your dependents. So when we're looking at the worksheet, everyone should have their own copy customized to them with their age and zip code, obviously. And then we're going to look at the plans that are available to you. So you'll notice there are 3 columns here. The first column is where the benefits are listed. So you'll see Aetna, United Healthcare, Kaiser, et cetera, et cetera. These are the plans that are available to you. These are the type of plan it is. It's an HMO plan. The name of the plan and the benefit level, or the metal tier. You'll notice these are silver plans, and then you have gold plans. Network name, Basic HMO, Alliance. Basic HMO is through Aetna. United Healthcare has Alliance Network. Kaiser says they have a full network because Kaiser will not restrict you as to which Kaiser clinic you can or cannot go to. When you're enrolled with Kaiser, you have access to all the Kaiser facilities. So with Kaiser, you don't really have to worry about a network. The next column over, the right column, lists the total cost of the plan prior to your employer's contribution. So here we're providing you with the gross rates of the plan. There's no contribution applied. This is what the true cost of the plan is. And the reason why we're showing you this is in case you wish to purchase coverage elsewhere outside of the Wireless Watchdog. Maybe you don't want to get it through here, you want to go somewhere else. Well, the Affordable Care Act, or the Obamacare, states that the price points must be level across the board. So it doesn't matter where you go. If you're enrolling on a silver plan, this would be the cost of the plan under Aetna. If you go here with us, or you go directly with Aetna, or you go directly through Covered California. United Healthcare, same thing. So we're showing you the pricing. So in case you do want to compare, you'll understand what the pricing points are about. The next column over gives you the cost per pay period. Now, although it says pay, it actually is a pay per pay period. I would like you to have a mouse here. Up here towards the top of the page on the left-hand side, it says your employer has made their contribution based on 26 pay periods. So these are what your deductions would be per paycheck, or every time you got paid, this would be deducted from your payroll. Now notice that the employee column has a lower amount, where the additional cost for the family is a larger amount. The reason for that is your employer is only sponsoring you, the employee, not your dependent. So if you wish to add your dependent, you would have to pay the full premium for them. Okay, so everyone is aware of that, right? Okay, good. So that's the first page. First column shows you the plans available to you. The second column shows you the gross rates, and then the third column will show you the cost to you after your employer has made their contribution. The programs or the benefits are listed in order of least expensive to most expensive. So that's why you see the PPOs towards the bottom of the page, because they're a little bit more expensive than the HMO plans. The next few pages that you'll see after this will consist of the benefits for each of the health plans. Because they were numbered in page 1, what you would do to reference the benefit description is look for the number associated with your health plan. So if you're interested in number 1, it would be Aetna Silver HMO. Here's providing you with the benefits. Now, I'm going to go over these benefits. If you have any questions with regards to the benefits, you go ahead and speak up. I was going to say raise your hand, but you can speak up and say, Junior, I have a question on what this means or what that means. Okay, everyone ready? All right. Can you hear me, Gary? All right. All right. Just want to make sure no one's answering. That's why I wanted to make sure that they were there. But okay. So the Silver HMO plan, first thing on the hand side, that's what I'm going to be going over. The middle tier, where it says middle tier and plan type, they're in the blue shaded area on the left hand side. I'll be going over those benefits, and then you'll know what they mean, and then when you review each of the plans, you'll know what you're looking at. So the first thing it mentions is HSA compatibility, or whether the plan is HSA compatible. Aetna number 1 obviously says no, but then you got United Healthcare HMO-C, Kaiser Silver HMO-A, both being HSA compatible plans. Now, if you're not familiar with what an HSA is or how an HSA plan works, well, an HSA stands for Health Savings Account. And when you have a health savings account, you can open one of those, a health savings account, at a bank which offers those type of accounts. Not every bank will offer it, of course. I know Wells Fargo is a bank which offers a health savings account. Bancorp is another. HSA Bank would be another that offers those. So you can Google HSA banks, and it'll give you a list of the banks which offer those accounts. Now, if you enroll in one of these plans, for example, Silver HMO-C with United Healthcare or Silver HMO-A with Kaiser, if you enroll in one of these plans, you will not get a full benefit or the full benefit of the plan unless you open that account at one of those banks. Now, the benefit would be that you can deposit up to, I believe, well, last year was up to $3,500 or $3,600 that you can deposit. The IRS does put limits as to how much you can contribute into that account because it's tax deferred. In other words, Uncle Sam cannot touch that money. That money is tax deferred, and you can only use it as long as you use it for medical expenses. So if you pull that money out and you use it for a vacation, then you will have to pay taxes on it. But if you're using it for medical expenses, it's going to be tax-free the whole time it's in there. Now, if you ever say to yourself, well, you know, I'm going to leave Wireless Watchdogs, I'm going to go out on my own, work somewhere else, well, that money that you have in that account, that's your money, and it travels with you wherever you go. You can roll it over to an IRA, or you can continue on HSA plans elsewhere, but that is your money. And if you ever need to withdraw it, then you will have to pay taxes on it, so be aware of that. This HSA plan does not cover any of your benefits, not an office visit, not an x-ray, not a prescription. It won't cover anything until you've satisfied the deductible. So if you're looking at the Silver HMO-C with United Healthcare, number 2, you'll notice the deductible there is $2,000. Now, if I'm on this plan, I would have to go to the doctor enough times where I'm paying for the visits myself, my labs, my x-rays, my prescriptions, and when I hit $2,000 in services, that's when the insurance will kick in. Then at that point, the insurance will pay 80% of my medical expenses, still leaving me with a 20% co-insurance. Okay, so those plans aren't for everyone, but you know, if you're the type of person who's healthy, doesn't go to the doctor all year, want to save money on your monthly premium, and then gain a little interest, have a nest egg there in that health savings account, then it might be for you. But if you need to access care immediately, or you really don't want to go through the trouble of opening a health savings account, then you may want to stay away from these plans. Okay. Any questions on that? No, perfect. Okay, so those are HSA plans. Again, remember, they don't cover anything until you've met the deductible. And if you don't open a health savings account at a bank, which offers one, you're really not going to get the full benefit of this plan. Okay. All right, moving on to the next thing is network name. This is really important for those of you who wish to keep your doctors, if you're enrolled on an HMO. If you're on a PPO, then you don't need to worry about it. But if you're on an HMO and you're going to move to another HMO, please ensure that your primary care physician belongs to the network associated with your health plan. Because if you look at number 1 there on that work that we have up, Silver HMO B with Aetna, the name of the network is called Basic HMO. Now, your doctor may say to you, hey, I contract with Aetna, I do accept Aetna HMO plans, but I don't belong to the Basic HMO network. I do belong to the Aetna Value Network, or I belong to these other networks, but not with the Basic HMO. If that's the case, then you would be losing your doctor. You wouldn't be able to keep that doctor if he doesn't belong to the network associated with the plan you're enrolling with. So be aware of that. You can always go to our website at calchoice.com. We have a provider directory there that is really user-friendly. You can look up your doctor by name, by carrier, by a city, or maybe you don't know of a doctor. You're just looking for doctors under a certain medical group or under a certain hospital association. You can look up the doctors that way as well. Okay. Next thing are the deductibles. Now, under the gold tier, the only plans that carry deductibles are the Kaiser HMO A under the gold tier, and the United, all 3 United Healthcare plans, A, B, and C. The deductibles under the gold tier, if you're enrolled in a gold level plan, those deductibles will only apply to hospital services. If you're not admitted to the hospital the entire year, you'll never be asked for your deductible. Your deductible, again, will only apply to hospital services. However, if you are on the silver tier, if you're enrolled on the silver plan, then the deductible will apply to a lot more things than just hospital services. It'll apply to big ticket items like MRIs, CT scans, things of that nature that it would cost a lot of money, I guess. So those type of things you will be subject to the deductible. When you get your plan description, it'll tell you what is and what is not subject to the deductible. Okay. The next thing it talks about are your office visits. Well, we all know what an office visit is. These will never be subject to a deductible when you go in for an office visit because you have a cold, a flu, or you've hit yourself on an end table. Whatever the reason that you're going to visit your doctor, you'll simply have the copay. The deductible is waived unless you're enrolled on an HSA plan. If you're enrolled with the United Healthcare Silver HMO-C or the Kaiser Permanente Silver HMO-A, those happen to be HSA plans and they will be subject to the deductible, those office visits. Now, the only thing that will not be subject to a copay or a deductible, and that includes the HSA plans, is your annual wellness exam. If you go in there for your physical, well woman care with immunizations, or well baby care, woman care with immunizations, well baby care with immunizations, or prenatal visits. Those are all considered preventive benefits. And when you have preventive visits, the Affordable Care Act states that they must be covered at 100%. Okay, so we encourage everyone to take advantage of that particular benefit. Go out there and get your wellness exam once a year. It won't cost us anything. Okay, every other time you will be paying out your copay. Lab and x-rays, we know what that is. You know, you need blood work, you need x-rays. These will be your copays. Deductible is usually waived on these particular services, except on most silver plans, the deductible will apply. Hospital services, when you're looking at hospital services here, it's actually talking about inpatient hospitalization. So in other words, you're spending the night at the hospital. If you're going to be released the same day or then it won't fall under this copay. This is only if you're spending the night there, whether it's for a surgery, a pregnancy, maybe having a baby, or God forbid you're in the ICU. Whatever the reason that you're spending the night at the hospital, this will be your copay. You will not have any additional charges to this copay. One copay will cover your entire stay, it covers the room, board, any other tests or visits from your doctor will be covered under one copay. Okay. Any questions so far? No. Okay. Emergency room, well, we all know where what the emergency room is. Those will be your copays under the emergency room. Now, keep in mind that if it's not deemed an emergency, the insurance carrier will not cover your visit to the ER. So an emergency would be a life-threatening emergency. You're having a heart attack, you're bleeding, have a fever over 103. Those would be considered emergency, and you would be able to be covered for that. Now, if you go and you don't have a fever of 103, and it's not deemed an emergency, you will not be covered, and you will be billed for that. So what we encourage you to do is go to your urgent care facility instead. Urgent care, you will not pay the higher copay. You'll simply pay what your office visit would be, and or lower. And there, you want to find out where your urgent care facility is prior to you having to use it. What you want to do is contact your primary care physician's office and find out where your urgent care facility is. Usually they'll give you like a magnet where you can put on your fridge, and it'll say your urgent care facility's phone number and address. But you want to be proactive. You want to know where it is, because if a doctor's office is closed at 7 o'clock on a Wednesday and you're feeling horrible, yet it's not an emergency, you can walk into the urgent care facility, be treated, and go home the same day. And again, it's a lower copay. Okay, so we encourage you to find out where that is prior to you having to use it. The next thing he talks about is outpatient surgery. This is when you're not admitted to the hospital. You go in there, maybe some stitches, that's for sure, I know is an outpatient procedure. So if you cut yourself or you get hit with a baseball in the eye, you can go to the doctor, and then they'll stitch you up, and it'll be considered an outpatient procedure. So those you will have different copays for, and those will be subject to the deductible as well. Okay. Prescriptions, all the carriers offer or cover both generic drugs as well as brand drugs, so you're able to pick up both. We encourage you to try and get generics whenever they're available because you have a lower copay with the generics. And you'll know some plans will carry a deductible for your brand drugs. So in order to avoid that, you want to get generics. Also, there are pharmacies, the major chain pharmacies like Rite Aid, CVS, Target even, have a list of prescriptions that you can get for $3 or $4. I always mention this because we want to be smart consumers. If your copay is $15 and the prescription you can get at Target for $3, put away your card, go to Target, pay the $3, and pick up your prescription. That's the best way to save money. That's really what it's all about. But sometimes generics, or should I say that, yeah, generics won't be available because the brand drug maybe have just come out. They have a patent on their formula. No one else can make that patent once it's expired. Usually lasts 7 years. Once it's expired, all the other pharmaceutical companies start making that generic, and then you'll be able to pick those up. But when there isn't a generic, we have to go with the higher copay. Okay, all the carriers will give you a 30-day supply for your copay, except for Kaiser. Kaiser can grant you up to 100 units for your copay, so it could be up to 100 days, just depending on how often you take your meds. All the carriers will also offer a mail order program where if you or one of your dependents are on a maintenance medication that you have to take regularly, you can order a 3-month supply for 2 copays, which is a great way to save money, and it's convenient because now we're no longer driving to the pharmacy to pick up our prescriptions. They're being mailed to our home, and we're only paying 2 copays for that 3-month supply. So it's, again, a great way to save money, and it's convenient. If you are interested in that, contact your respective carrier, let them know you're interested in the mail order program, and they'll sign you right up, send you an envelope. You fill out the envelope, mail it back. Next thing you know, you got your prescriptions at your door. Okay? So take advantage of that particular benefit. And then finally, we come to the out-of-pocket maximum. You'll notice you have an individual out-of-pocket maximum, and then you'll have a family out-of-pocket maximum. Now, all of the plans have this, and they all work the same exact way. So what I'm going to do is I'm going to use the number one, Silver Aetna HMO, as the example. You'll notice it's $6,000 for an individual, $12,000 for a family. So let's suppose that we have a family of 5 people. Okay, let's say we have mom, dad, and 3 kids. Okay, and let's just suppose the dad's the one who goes to the doctor the most. So dad's going to the doctor, paying co-pays, paying deductible, paying co-insurance. prescription copays, et cetera, et cetera. So let's say dad hits $6,000 out of his pocket, out of his expenses, and all those copays and coinsurances. Well, we know that at that point, dad's met his maximum out-of-pocket expenses. So from that point forward, dad will be covered at 100%, regardless of what dad goes in there for. So dad will now no longer have copays, coinsurances, or deductibles. So now if dad goes in there for some stitches or a triple bypass heart surgery, won't matter. Dad's covered at 100% and he will not pay a single dime out of his pocket. Why? Because he's made a $6,000 out-of-pocket maximum as an individual. Now, mom and the 3 kids in this family will still continue to pay their copays, deductibles, and coinsurances. But let's suppose that mom also reaches the $6,000 mark. Well, if mom spent $6,000 out of her pocket and dad also has spent $6,000 out of his pocket, well, then that equals up to $12,000. And $12,000 satisfies the family out-of-pocket maximum, so which means none of the children in this family, if they ever end up going to the doctor, will have to pay a copay or deductible or a coinsurance, okay? Because now the family's met the out-of-pocket maximum with dad and mom. But it could also be that maybe dad hits only $2,000. Mom also hits $2,000, and then one of the kids hits $2,000. I'm sorry. Let's do $3,000, $3,000, $3,000, $3,000. That would satisfy the family deductible of $12,000. Okay, so notice in that scenario, none of them met the individual out-of-pocket maximum, but collectively they all met the family out-of-pocket maximum. So that also satisfied it. Okay. Any questions on how that worked? Good, good, good. Well, those are the benefits. We want you to look at them at your leisure. You're also being offered, let me see, Gary, they got the voluntary dental and vision as well? Or is that through another account? Check the very last page of these worksheets. Page 7 for this guy, yeah. It'll tell us on there. Is there a page 7? Oh yeah, it was page 7, no. I can't check, Gary. Let me check really quick. It's on my phone. It's the enrollment application. You'll notice the company name has already been filled out for you where it says Wireless Watchdogs. Up there above section A, you'll see there are 4 boxes, but we're going to ignore those. That does not apply to us. Let me see. Oh, I'm in trouble with my computer. All right, there it is. Okay, so you have company name, Wireless Watchdogs. We've added that for you. Your job title, you let us know, and your full-time employment date. If you're not familiar with your full-time employment date, you can just put the month and the year if you're not exactly sure the date. After that, the next section or the rest of the section, you can fill out your own. Only you know the answers to these questions. It's your gender, your marital status, last name, first name, and social. Now, it's important that if you mark you're married here or you have a dependent or a domestic partner, at the very last page, there'll be a waiver, and I'll be going over that with you later, but just be aware that you would have to sign a waiver if you're not going to add any one of your dependents, okay? We'll go over that later. But here in the address section, we want a physical address, not a P.O. box. If you do have a P.O. box or you have a separate mailing address, it goes in the very last line of Section A, right there. Section B, you will be providing us with the information of your dependents if, in fact, you're adding them. If you're not, then we don't have to fill anything out for them. We're just going to go to the employee column and check the box what we're enrolling for. Since the only thing we're offering through CalTrades is medical, we're going to check the medical box. Okay. Then we're going to go to the next page, and it's just going to get easier. The next page, Section C, ask which plan you wish to enroll with. So here, you're going to just pick one of the plans that are available to you on your worksheet, Aetna, Anthem, Cross Health at Kaiser, or United Healthcare. Sharp and Western Health are not available in Southern California. Western Health is only available in Northern California. Sharp is only available in San Diego County. All right, and then in the next section there, you'll give us the name of the prime. Oh, I'm sorry. Go up a little bit, back to section C. There, right under section C, you'll see where it says employee, spouse, domestic partner, child 2, child 3. That's where you're gonna let us know of the primary care physician that you wish to enroll with. You're gonna give us the name, whether you're a current patient of his or her, and their provider ID, which you'll get from our website at caltrace.com, and then the city in which they practice. Now, if you don't know of a doctor, you can check the box that says check here if you'd like your health plan to assign your primary care physician. If you don't know a doctor, they'll assign one to you based on your zip code, so it's not going to be too far from home. Now, if they do assign you to a doctor that you're not familiar with, you don't like, for whatever reason, you can always change your doctor on a month-to-month basis. All right, so you won't ever be able to have 2 doctors in 1 month. You'll only be able to have 1 doctor per month. All right, and then section D here, we're going to skip it all together. I believe you guys are being offered a premium only plan. This, where it says POP, this allows you to pay your insurance premiums before Uncle Sam touches your money. So before you get taxed, you pay your money, which allows Uncle Sam to tax a lower amount and allows you to take home more money, and it helps reduce the cost of the premium by maybe $3 or $4 per month. So you do want to check that box there. Not many companies offer this type of benefit, but Wireless Watchdogs is offering it, and you must take advantage of it. Okay? All right, the next page is your legal acknowledgement. You're going to read your legal acknowledgement, and then towards the bottom of the page, you're going to sign, print, and date. This is what gets you enrolled into the plan effective, is it April 1st or May 1st, Gary? April 1st. Yeah, April 1st. Sign, print, and date, and that'll get you enrolled. Now, the very next page is the waiver that I had mentioned at the beginning of the form. If you mark that you are married or have a domestic partner, or maybe you are not enrolling on the plan because you have coverage elsewhere, maybe through your spouse or through your parents, you're able to do that. This is the waiver. You're going to fill out the company name, your last name, first name, and social. Leave the group number blank. We don't have one yet. And then you're going to go to section B. If you're waiving coverage for yourself, you're going to check the first box where it says medical, myself, and dependents. If you're waiving your spouse or domestic partner, then you're going to check the second box. And if you have children under the age of 26, which you're not going to enroll, then we'll check the third box. Don't worry about the dental section. Section C asks for a reason. However, we only need a reason if you, the employee, are waiving coverage. If your spouse or children are waiving coverage, we don't require a reason for that, only you. So you'll mark the box of what the reason is. You have other group coverage. Meaning you have coverage through your spouse's employer or through your parent's employer. You can have that coverage. Give us the name of the insurance carrier, Aetna, Blue Cross, Blue Shield, Kaiser, whatever it is, and then give us your group number. If you're enrolled in Kaiser, you may not have a group number, so just give us your medical record number and we can verify it that way. Or you may have Medicare, you have Medi-Cal, you have an individual policy, or there's just maybe another reason why you're not going to enroll through your employer. Once you do that, you're going to go to section D and you're going to sign and date that section and you'll be done with this enrollment application. Okay. Any questions on the app? All right. Now we're going to talk about the dental and the vision plan. I know you guys are excited, but this is going to be really, really quick. I know you're eager to go back to work. This is going to be simple, but you do have choice here as well. You have 2 HMO plans to choose from through Delta Care USA, which would only be available here in California. And then you have the PPO plans through Emeritus Group. Those are available out of state. I'm going to go over the HMOs first. We're looking at the Delta Care USA HMO Silver and Gold plan. You'll notice both of them cover the exact same things. It's just that the Gold plan is a bit richer because the copays are lower, and in some instances you don't have any copays at all. What we like about this plan is that there is no annual maximum. You'll notice the first thing it mentions, annual maximum, there is none. What that means is they won't cap your benefits. Here, you can go as many times as you need to. All you have to do is pay out your copay and you'll have the coverage. Deductibles under this plan, that's another great thing about it. It's similar to the medical side where all your annual wellness exams are covered at 100%. Here, all your preventive benefits are covered 100% as well. You'll notice the initial oral exam and your periodic oral exam. That means every 6 months, which is what is recommended by your dentist. You go every 6 months, you get your teeth cleaning, your oral exam, and your bite wing x-rays at no charge. So as long as you're having a healthy mouth, no cavities, you're not going to have a copay. Now, you do start getting into copays under restorative. You see there, cavities. Your first service with an amalgam filling is $5 under the silver plan and $10 for 2 fillings. But on the gold plan, you'll notice it's still covered at 100%. So it is richer plan. There are no waiting periods here for major services like extractions, bridges, crowns, or oral surgery. You're not going to have that waiting period. You're covered for orthodontia for both children as well as adults on both plans. Okay. Those are the HMO policies that you can review at your leisure. On the right side, you find the Emeritus Group PPO plans. You have the silver, gold, and platinum. With this plan, you'll notice that you do have caps on your benefits. So your maximum on the silver is $1,000. On the PPO gold, it's $1,500. And on the platinum plan, they're giving you $2,000. And these are all calendar year maximums. And what that means is from January 1st to December 31st, this is the allotted amount your insurance carrier is providing you with. Now, if you use up the full 1,000, the full 1,500, or the full 2,000, then you'll have to pay anything above that on your own. So if you know you're going to have a lot of work done, what I would suggest you do is try to hold off, if you can, of course, till October, November, or December. Because if you use up your entire annual maximum then, come January 1st, you get a whole new annual maximum. So you have another 1,000, another 1,500, or another 2,000, depending on the plan you're enrolled with. Okay? You guys understand that? Got it? All right. Yep. All right. The annual deductible, its deductible is $50 on the silver and gold, but the platinum has a $100 deductible. So that will apply to all the services under the platinum plan, but the deductible is waived for preventive services under the silver and gold. Preventive care is covered at 100% on the silver and gold, but platinum, you'll notice, covers it at 75%. Major and endoperiodontics, you see the coverages there. Now, those are your in-network benefits, and I do want to tell you for basic services, there aren't any waiting periods, but for major services, there will be. It's a 6-month waiting period, so you have to be on the plan 6 months before they'll cover you for any crowns, bridges, surgeries, extractions. Those are considered major, okay? Orthodontia is not available under these plans, meaning braces for your children. So if you need braces or your children need braces, you would have to enroll on the HMO plan in order to have coverage. And again, I would be available here in California. Out-of-network benefits, they look similar to the in-network benefits. You may say, oh, I have 80% coverage out-of-network, but I also have 80% coverage in-network. Well, when you go in-network, you're actually visiting a dentist who's negotiated a contract with Emeritus Group or your PPO plan. So when you're paying 20% of that service, you're paying 20% of a negotiated and contracted rate. However, if you go out of network and you visit a dentist who is not contracted, then they'll be paying 80% CR, which means usual and customary rates. All that means is whatever 9 out of 10 dentists in that city where you went and got your procedure done, whatever 9 out of 10 dentists charge for that procedure, that's what they're going to pay 80% of. So if you ended up going to the most expensive dentist, you are going to be paying probably a lot more than 20% of what you would have paid going in network. So you want to be aware of that, okay? In-network and out-of-network benefits are going to be totally different. You'll pay a lot less going in network, and we encourage you to go in network when possible. Now you'll notice there are some dental rewards there. You see dental rewards. You get an additional $250 on the silver and gold plans when you do not exceed $500 in benefits. So if you didn't spend $500 of your annual maximum this year, you're going to get an additional $250 added to your annual maximum the following year, come January 1st. If you win in network, then you're going to get an additional PPO bonus of $100 added to your annual maximum. The maximum carryover amounts to $1,000. So once you hit that, they won't carry over any more amounts. So you can get $1,000 added to your annual maximum. That's the maximum that could be added to your annual maximum. All right, now we're going to look at the rates unless anyone has questions with regards to the dental benefits. Perfect. All right, the rates are listed at the bottom. You'll notice there are 4 columns there. You have the employee-only column, additional cost for your spouse, additional cost for children, and additional costs for family. Now, the employee-only column obviously is only for you if you're enrolling by yourself. But if you wish to add your spouse, then you're going to add the first column to the second column. If you're adding your children, but not your spouse, just you and your kids, doesn't matter how many kids you have, you're going to add the employee-only column to the additional cost for children. You add those 2 columns, and that'll give you the cost for you and your children, no spouse. If you wish to add your spouse as well as your children, then you're going to add the employee-only column to the additional cost for family. You add those 2 columns, and that'll give you the cost for you, spouse with children. The rule of thumb is we never add more than 2 columns at a time. Okay? Any questions on that? No. All right, and these are monthly rates, by the way. Okay, and we'll move on to the vision section. Now, the vision, there are 2 plans to choose from. You have the gold and platinum. They're both identical plans. They both have the same co-pays. However, the difference is the frequencies, meaning how frequently can I access my benefits. Under the gold tier, you'll be able to get an eye exam every 12 months, lenses every 12 months, but your frames, you'll be able to get covered only every 24 months or every 2 years. Under the platinum plan, you get all 3 every 12 months, eye exam, lenses, and frames. Okay? If you wear contacts, you can get the contacts every year. These are the benefits. Your eye exam on the plan would be $10 when you visit your optometrist, would be a $10 copay for your eye exam. Your frames are covered at 100% up to $150, so they give you $150 to purchase frames. Anything above that, you would pay the balance. Your lenses are a $25 copay for the pair. And if you're going to pick up contact lenses, then they give you $150 towards your contacts. Anything above that, you would pay the balance on. Any questions on the vision benefits? That was, yeah, that was pretty easy. All right, and then finally we get to the chiropractic and acupuncture benefit. Not many employers offer chiropractic and acupuncture, so it's really nice that they're offering you this plan. It's $2.14 a month. For that, you get enrolled into the chiropractic or landmark healthcare network. It's a network of chiropractors that will give you the lower copays for your visit. So you'll notice the initial evaluation, etc. That's $45 per visit. If you need a re-examination or even a home expanded home visit, it states $30 per visit. So you see, it covers all these things. And then on the acupuncture, the same thing. Your evaluations are all covered, and wow, even electroacupuncture is covered. So, I mean, all these benefits you can get for that $2.14, and you can add your entire family on this plan for the $2.14 a month. Okay? Any questions on the chiro acupuncture? All right, then we'll get to the application. And there's a separate application for the dental, vision, chiro, and that's what we'll be going over now. Similar to the medical app, so it kind of looks the same. We've entered the Wireless Watchdogs name for the name of the company, employer phone number, job title, and your full-time employment date, your gender, your marital status, etc. Same thing as the first application. So again, if you have a physical address, it goes in the very last line of Section A. Section B, same thing. Here you provide us with your dependent information. If you're not adding dependents, and simply let us know what you're enrolling in, dental, vision, or chiro. Same thing for your dependents. Maybe you have kids that need glasses, or maybe they just need dental work. You can add them on one line of coverage, or you can add them to both. Mix and match, however you please. The next page will ask you, what plans do you want to enroll with? So Section C, under the Delta Care USA HMO, just check the box, gold or silver. Under the PPO, same thing, platinum, gold, or silver. Under the HMO, you can give us the name of a dentist at a primary dental office that you wish to be assigned to, or you can leave it blank and check the box that says, check here if you would like your dental plan to assign. It's at the bottom, assign you a primary dental office. So you check that box, and most people do that. Most people don't know of dentists, so they just check the box, and they'll be assigned a dentist. Now, if they assign you to a dentist that you don't like, doesn't speak your language, or whatever the reason is, you can always switch your dentist on a month-to-month basis. You don't have to be committed to the same dentist for the full year. Okay? Section D asks for the vision coverage that you want. Do you want the platinum, gold, or silver? Just check the box, and that's what you'll enroll in. Chiropractic, Simply check the box if you want to add it. If you don't want to add it, that's fine. We're not offering the live, so we can skip that. And we're going to go to the premium only page. If you want to pay your premiums on a pre-tax basis, just like on the medical side, you check that box. All right, and then going to your legal acknowledgement, the next page. Read your legal acknowledgement, and then you sign, print, and date the bottom of the page. And then, again, you have a waiver if you're not going to be adding your spouse or your children, which are under the age of 26. Okay, same thing with the waiver. We only need a reason if you, the employee, are waiving the coverage. If your dependents are waiving, it's okay with us. All right. Sign and date the bottom, and we're done with the application. Any questions from anyone?